You are a nurse. You have been working through this pandemic, and we've been hearing the negative effect on mental health. Mm-hmm. What is like for the nursing professional in your mind? Mm.
Thank you, Jimmy. As a registered nurse, I particularly appreciated when you said that there has virtually been a silence around what it's like to be a healthcare worker, and truly that's what it's been like. So I'm just so delighted that you're having us here to give us more voice to what we're dealing with. You know, we're faced with trauma on a daily basis, right? We deal with grief, we deal with dying, pain, and suffering. And since the pandemic, it's only magnified our poor mental health. At the very beginning, we had to fight for personal protective equipment. Patients now, and for over a year now, today marking that anniversary, where patients are lonely, they are unable to have visitors, and as nurses, we go into that profession because we're innately caring and we're compassionate, and so we're faced with moral distress. We watch our patients go through that loneliness. And also, very often now, we're the last ones to be with a patient who may be dying, the last face that they see. So it's very traumatic, and couple that with the stress and the distress and feeling unsupported and undervalued, overworked, certainly during COVID. It's no surprise to me that survey after survey indicates that almost 2/3 of us are burnt out, done, emotionally depleted. 1/3 of us are dealing with depression, and nurse professionals have the higher suicide rate than the general population. And all of that has been magnified by COVID. So it's just emotionally exhausting. We need to work harder. We need to have more of these conversations to help us. And then when you talk about the workplace environment itself, Jimmy, there's some toxicity, there's harassment, there's bullying. I could go on and on about that, but COVID has really magnified and amplified the poor mental health that we have. And recently, our profession lost an early career nurse, and my heart breaks, and it's really hard to even talk about that because no nurse, no healthcare worker, the population in general, we're all suffering. And I think collectively we just need to support each other and understand each other and have more compassion and kindness.